It's a Northwest Lifestyle Weekend on Como News. IRG's Health Talk continues.
Shannon, it all starts with the feet when it comes to most sports, and we got a guy to talk about that, Dr. Eric Powell.
You're exactly right. The feet are the foundation, and they're important. If you've ever hurt your toe or sprained your ankle, you can appreciate that.
Dr. Powell is a podiatrist from Foot and Ankle of Edmonds, and here he is.
Dr. Eric Powell, welcome to Health Talk. You having a good day?
I'm having a great day. Thanks for having me.
Well, thanks for joining us. Hey, we're going to talk about turf toe and some other common foot injuries, but let's talk about your practice first. Tell our listeners about the day in the life of Dr. Eric Powell and your interest in foot medicine and foot injuries. So just set us up here. Give us a little history.
So I'm a podiatrist, and I practice up at the Ankle Foot of Edmonds Clinic in Edmonds, Washington. And day in the life for me just consists of being in clinic a few days a week. I have a surgery day once a week, and just trying to help people get better. And
you take care of common foot problems and musculoskeletal injuries of the foot, whether it's sports, recreational, occupational. You kind of handle the whole gamut of foot. Anything below the knee essentially is kind of the wheelhouse you work in.
Correct. Anything foot and ankle related, we handle and take care of.
How'd you get interested in this? I mean, obviously you went to school, undergrad. I think you went to the University of Washington.
I did.
And during that process, kind of looked around, probably enjoyed sciences and anatomy and physiology. But why podiatry?
So in undergrad, I worked as an ER tech and in an emergency room for a few years, and was fortunate to see a lot of different specialties, spent time with a lot of different docs, and knew I wanted to work in medicine. Kind of coming to graduation, nothing was seemingly really clicking, so I actually randomly just called up a couple podiatrists in my hometown up in Mount Vernon and spent some time with them. Just really enjoyed their attitude, really enjoyed what they did. It was just a seemingly a good fit for me, and that's pretty much how I got into it. So.
Okay, born and raised in Mount Vernon?
That's right.
Matriculated to the University of Washington?
Correct.
And then went to podiatry school in Iowa. Is that right?
Correct, Des Moines, Iowa, yes.
I've studied you.
I could see.
Yeah, so here we go. We're going to talk about some injuries. One of the things we want to talk about is turf toe. And we see it in the media, particularly as it pertains to professional athletes. Sometimes it can be a career-ending injury, this turf toe. It's called turf toe for a reason. I've had it personally. It's really painful. I mean, it interferes with a lot of activity, and particularly walking and running. So let's talk about turf toe from kind of a clinical standpoint. What is it? Mechanism of injury? How do you treat it? What are the outcomes? Let's cover that topic. You ready?
I'm ready.
You
Sounds
psyched?
good.
You pumped?
I'm ready to go.
Okay, here we go. Yeah.
So turf toe, basically it is a sprain of the big toe joint. There's different grades. We grade sprains three grades. Grade 1 is a stretching of the ligaments. Grade 2 is a partial tear. Grade 3 would be a full tear. So just like you can sprain your ankle, you can have various grades of sprains of the big toe joint. And again, we call that turf toe. Typically, it's going to be some kind of an extreme dorsiflexion type injury where the toe is pushed up, usually pushing off. We see it a lot in soccer players, football players, where they're going to push off, against a lot of weight, and the toe just gets a lot of extra pressure on it and causes the ligament to stretch out or tear.
Let me jump in here real quick for our listeners, because we're describing, anatomical positioning and mechanics on the radio. So when you say dorsiflexion, let's just talk about that. So what you're basically talking about is when you plant and roll up onto your toe, if you drive that toe up towards your head too much, that's dorsiflexion or hyperextension. It tears those ligaments, sprains those ligaments are injured, and that then becomes a problematic situation, turf toe.
Correct.
Yep. And it's super painful.
It is very painful. It's, you're walking on your foot all the time, of course. So any step you take, it's going to put stress and strain on those ligaments that are already damaged, which continues to cause pain and discomfort. So typical treatments for turf toe, first line therapy is just really immobilization, letting it rest. Usually that's sufficient enough. If symptoms linger and aren't getting better, sometimes we'll get an MRI. Even sometimes we'll shoot dye into the joint and get an MRI to see what the ligaments look like, to see if there's an actual tear. And then based on that, sometimes surgery is even indicated to go and repair the damage.
And when you grade these, I mean, being in medicine, we like to grade everything.
Of course.
So it always has a grade. So we probably, I used to talk about level 3, 1 through 3, 3 being significant, 2 being moderate, and 1 being minimal. And based on that early grade, really is kind of, we talk about outcomes or recovery.
Correct.
More with Dr. Eric Powell coming up right after this time out on Como.
It's a Northwest Lifestyle Weekend on Como News. Here's Tom Hudler and Shannon O'Kelly with more IRG Health Talk.
We're talking about foot care in sports. Dr. Eric Powell, a podiatrist from Foot and Ankle of Edmonds, is our guest, and here is more with him and Shannon O'Kelly.
Dr. Powell, again, welcome to Health Talk, and thank you so much for taking time out of your day to join us, and thank you for describing turf toe for our listeners. Great job on that. But I want to talk about return to play because it can be complex, and it can be kind of frustrating for the athlete because it is a ligament, and it does need to heal. And the foot, when you run and walk, your toe basically naturally goes into that hyperextension or that extension. And if it can't do that, you can't roll up and push off, can you?
That is correct. That can impart some pretty significant activity limitations for sometimes a prolonged extended period of time. A lot of these rest, sometimes steroid injections, obviously ice, anti-inflammatories tends to get you better, but these can be, like you said earlier, can be career-ending injuries for some certain high-level athletes. Those kinds of things, unfortunately happen. So first thing is rest. That's what you have to do.
Right.
You let these injuries rest, and that's very hard to do for an athlete.
Absolutely,
they want to keep going, and that's where things like physical therapy and a multimodal kind of specialty approach to this comes into play.
Yeah, it's almost a biological situation. You just have to rest and give the body time to relay down what we call collagen to heal that ligament, because ligaments are different than tendons. They're fibrotic. They have a lot of ability to hold the joint, so they've got a lot of tensile strength. And when you irritate them, it takes longer to heal sometimes with a ligament versus maybe a muscle or tendon.
Correct. Yeah. Everybody says a sprain is worse than a broken bone, and that is true a lot of the times because of the thing with ligaments is they don't have a lot of blood supply, so it takes them a little bit longer to heal up than if you broke a bone or even a tendon, which tends to have a little bit better blood supply. So they can be a little bit more of a lingering type injury for people, and that again can be very, very frustrating for somebody who wants to be very.
Yeah, it can. Let me talk to you about something else. This is kind of a personal call, me to you. Okay, you ready for some consulting here? Okay, so we're going into ski season. We are in the fall, best time of the year as far as I'm concerned. I love the fall, and I love the fact that pretty soon snow will be flying in the mountains and we'll be out skiing. I've experienced personally toe bang, where I go out skiing and my big toes bump into my boot. Obviously, I need to work on my boots, but then I get a bloody nail bed, and it can be really painful. I mean, should I drill it? What should I do when I get that? What is the treatment for that, or those folks out there that might have toe bang with a bloody nail bed?
It could be a simple fix as getting boots or shoes adjusted. It's really important to get measured and get fit for the right size of shoes.
Particularly ski boots, right?
Correct. Yeah. Ski boots are a little trickier, obviously. Sometimes you got to get them heat molded and get a punch out on them and whatnot. Treatment wise, it can run the gamut. Usually, if you just let it be, it'll grow out, and then the nail will probably fall off on its own, and a new nail will grow back.
That's what mine did.
And sometimes you can, if you're really careful, you can even drill a hole in the top, get the fluid out, drain the pressure, equalize it. That helps reduce discomfort associated with it. But overall, there's not typically a lot to do. One thing you have to be mindful of is if the nail loosens up, or you drill a hole in it, there's always a small risk of infection. So you have to just be mindful of that.
All right. Hey, again, great stuff. Thank you so much for joining us. And I'm going to check my boots out and get them fitted for the first time. So thank you for that information.
No problem. Thank you very much.
We've been talking about foot care in sports with Dr. Eric Powell. You can get more information at afdoctors.com. And the foot, as we mentioned, Shannon, or the feet, if you want to run, walk, hike, bike, whatever it may be, it all starts with the feet.
It really does. It doesn't matter what activity, whether it's recreational sports or going to work. If you have a foot problem, that's the foundation. Once you understand gait and foot mechanics, you really appreciate the complexity of the area. So don't go living your life with foot pain when you can treat it.
Absolutely. Thanks again to Dr. Powell. We're back with our final segment next on Como.